I'll be your moderator for tonight, and Dr. Molina will make the main presentation. We'll just talk briefly about the South Asian Heart Center and the issue of heart disease in South Asians. South Asians are more prone to heart disease and heart attacks compared to other populations, and it's happening in seemingly healthy young adults. 50% of heart attacks occur before the age of 55, 25% before the age of 40. It's more severe and malignant, 2 to 4 times the risk of heart attacks, twice the rate of mortality after a heart attack, at least twice the incidence of CAD compared to other populations, and 60% of the world's heart disease burden is borne by Indians. So the question always comes up, why are South Asians at a higher risk of heart disease? There are 3 generally known reasons for that. The first is that the conventional risk factors appear in South Asians early, and they carry an excess burden of those risks. The second reason is the lifestyle. The shortage of protective behavioral factors in this population, less active lifestyles, and less consumption of fruit and vegetables. And finally, there is a genetic predisposition and some additional inflammatory markers that are marked in this population. The South Asian Heart Center was created to reduce the high incidence of heart disease in South Asians through a comprehensive, culturally appropriate program that raises awareness through education, evaluates risk with advanced screening, and facilitates lifestyle changes with heart health coaching. The South Asian Heart Center is located at El Camino Hospital in Mountain View. The program at the South Asian Heart Center consists of assessment, which is a detailed and comprehensive assessment that includes lifestyle assessment, clinical assessment, both medical history and family medical history, followed by a biometric evaluation and advanced laboratory test. That is followed by a personalized risk report that we have discussed with you, and then walk you through a management program that is predominantly lifestyle based. We send your results back to your physician so that you can get counseling on medication and ongoing medical evaluation, whereas we focus predominantly on the lifestyle changes. So we have put together this seminar series. Today is the 4th in the series. We had started in January, and it's on rest, which is the 3rd aspect of lifestyle that we focus on at the South Asian Heart Center. You may visit the South Asian Heart Center to get screened and follow our program. We will now continue with the main presentation with Dr. Molina. Dr. Molina is the co-founder and medical director of the South Asian Heart Center, has and does cardiology practice in Mountain View. He has completed his fellowship at Stanford, graduated from medical school at Yale, and is being the driving force behind the program at the South Asian Heart Center. So without further ado, this is Dr. Molina.
Thank you, Ashish. So our topic today will be restful sleep and restful alertness. And today we'll go over the data. This is actually a science-based presentation of the benefits of sleep and the benefits of restful alertness brought about by yoga or transcendental meditation in this case. So these are the objectives for today. We're going to discuss the lifestyle associated with successful aging and longevity. So before we do that, we need to define successful aging. Well, successful aging means that you have stayed alive, you have not died, you have shown some longevity, and at the same time, you have maintained your self-sufficiency and independence, your autonomy. That means you can take care of yourself, shop, care for your home and do your daily chores. Ending up in a nursing home as a patient in a nursing home is a definition of unsuccessful aging. We'll go over the data on the importance of the, daily regular routine to achieve longevity and successful aging. Subsequently, we'll talk about the physiology of sleep, since sleep is one of those important factors in our daily regular routine. We'll go over the epidemiology, the sequence of sleep. We will talk about the effects of short sleep duration and on chronic diseases. We'll talk a little bit briefly on sleep and the circadian cycle. And the question is, how much, when should we sleep? What is the effect of napping? And to answer those, this issue about circadian cycle is very, very important. Sleeping outside of your circadian cycle at 3 o'clock in the afternoon is not the same as sleeping from 10 p.m. To 8 a.m. In the morning. So this sort of effect of power napping, trying to make up for poor sleep at night, unfortunately, does not achieve the desired effect because it is contrary, it's not happening as part of your normal circadian cycle. Subsequently, we'll talk about the physiology of restful alertness and the different forms of meditation, the physiology of transcending. We'll talk about stress and stress reduction, and we'll define stress. And lastly, we'll go over the physiology of restful alertness and its medical implications. So let's go over the Alameda 7. This is a slide that we use in all our presentations. This was one of the first studies demonstrating the value of regular routine. Ashish mentioned at the beginning of our conversation that the mission of the South Asian Heart Center was to provide technologies that were culturally appropriate. And as part of Indian culture, Ayurveda is a very important, or the native medicine of India, and Ayurveda is actually mainly based on the importance of regular routine. So this paper, which was published in 1980, actually showed the importance of regular routine in maintaining longevity and achieving successful aging. So they studied 7,000 people, and they were followed for 25 years, and 7 factors were identified. Those factors were adequate sleep, 7 to 8 hours per night, and half of this conversation this evening will be talking about the science behind adequate sleep. We have talked before on the benefit of regular vigorous activity, burning 3 kilocalories per kilogram per day. That is about 210 calories per day for a typical 70 kilogram person. Maintaining recommended weight, that is not being obese, not smoking, none or moderate alcohol consumption, that is not exceeding 5 drinks per day, eating breakfast daily, and eating meals regularly and no snacking. So we have talked about the effect of nutrition on successful aging, and I think that we have done that in the last 4 to 6 weeks. So let's sort of talk a little bit about what we mean by resting while asleep. So let's define sleep. Sleep is a naturally recurring state characterized by reduced or absent consciousness, relatively suspended sensory activity, and inactivity of most voluntary muscles. The key here is the absence of consciousness. When we're asleep, we have decreased ability to react to stimuli. Sleep is a heightened anabolic state. That is, during sleep, we grow, we rejuvenate our immune, the nervous, skeletal, and muscular systems, and is observed in all mammals, all birds, and many reptiles, amphibians, and fish. To note is that hibernating animals, actually, they sleep and they dream during their hibernation. And it's of note that when they actually go into the dreaming state, they can only go into dreaming state when their metabolic rate goes up, and for that period of time, they are actually no longer hibernating. Now, what are our sleep requirements? Well, our sleep requirements vary depending on our age and our health. Newborns require between 12 to 18 hours per day. Infants aged between the 3 and 11 month old required 14 to 15 years, 14 to 15 hours per day. I'm sorry. Toddlers 12 to 14, and moving down to adolescents between 8.5 and 9.25 hours. It's sort of very important to note that actually most adolescents today are getting much less than this, particularly if they're going to a very high-power school and taking AP classes where they are required to study around the clock and do all-nighters, and actually they are getting sleep deprived. Adults, including the elderly, require between 7 to 9 hours, and pregnant women a little bit more than 8 hours. And we'll go over the data that indicates this sort of nice sweet spot in adults between the 7 to 9 hours. And that will be the theme of the rest of our presentation. Now, unfortunately in America, the time spent sleeping has been trending down. At the beginning of the 20th century, the typical American slept 9 hours per night. In 1975, it went down to 7.5 hours. By 2005, the average American slept only 6.8 hours. Now, sleep is a heterogeneous process. There are 5 main cycles or stages to sleep. And this sort of sleep cycle made of these 5 stages starts with the transition between being awake and asleep. It lasts 1 to 5 minutes. It accounts for about 2 to 5% of the sleep cycle, and it's marked by theta waves and periodic alpha waves. If you're awakened during this period, you will tell the person who has awakened you that you were really not asleep, that you were still awake. The second stage of sleep lasts about 20 minutes. Your heart rate starts slowing down, your temperature starts dropping, you have sort of rapid burst of rhythmic brain wave activity, and those are known as sleep spindles. In the third stage, you transition between light to deep sleep, and then you see the appearance of delta waves. These delta waves in the stage 3 become much more prominent in stage 4, where you get marked slowing with delta waves, and in fact, this period is where you get the most profound rest, and it tends to last about 30 minutes. At the beginning of the sleeping cycle, we go through 1, 2, 3, 4, and then we end up in what we know as REM sleep, which is also known as dreaming. It is here where your respiratory rate increases, your brain activity increases, and while your brain and other systems become very active, your muscles become paralyzed and relaxed. So as you're running through a field in your dream, you're actually unable to move your muscles. They have been functionally paralyzed by your brain so as to experience this dreaming state. Now, this is a typical sequence of sleep stages. You're awake, then you move on to stage 1 for a few minutes. If they wake you up around this time, you feel that you have really not fallen asleep. Then you go into stage 2, stage 3, and then you have this prolonged stage 4 where you have delta waves, your metabolic rate goes down, you get very, very deep rest, and then you move on to a little bit of REM sleep. You actually go through the same process, and as the night goes, you actually progress more and more into REM sleep. Many times individuals wake up from REM sleep in the mornings, and that's when they actually will report that they remember their dreams. Now, what are the consequences of inadequate sleep? So there are 2 types of inadequate sleep. One is when you get insufficient sleep or you're sleep deprived. Typical example of one of your high school student taking 5 advanced placement classes. He is not getting or she's not getting sufficient sleep. Or you can also see fragmented sleep, where you have sleep disruption. This is commonly seen in house officers who get paged frequently by the hospital or their patients. It's seen commonly in individuals who have problems with their prostate and have to wake up frequently at night to urinate. But it also happens frequently in our society with increasing obesity in our society. We're seeing more and more sleep apnea that then leads to fragmented sleep and its clinical consequences. These two lead to excessive daytime sleepiness. There are neurobehavioral deficits associated with this, with cognitive dysfunction and attention deficit problems. There are problems with performance, and there's an increase in accuracy and errors. And then, medically speaking, there are some cardiometabolic consequences, problems with appetite regulation, development of high blood pressure, and obesity, and we'll be discussing this as we go along. Ultimately, inadequate sleep is associated with decreased successful aging and an increase in morbidity and mortality with a decreased quality of life. This is actually a slide, and this slide this slide actually was that I just was going to show you something happened here that indicated that during the time change, when individuals have less sleep, there is a significant increment in the number of automobile accidents. And on the other side, when we gain 1 hour of sleep, there is actually a significant drop in the number of car accidents. Moving forward to sleep deprivation, there are some significant cardiometabolic risk factors of sleep deprivation. Those are obesity and increases in body fat distribution, development of type 2 diabetes mellitus, and development of hypertension. There are changes in total and cause-specific mortality, and there's also an increased incidence of coronary artery disease. As you can see that often when we have disruption of sleep, as with sleep apnea, where there is actually a congregation of hypertension, heart disease, obesity, and diabetes in patients who suffer from sleep apnea. Now, this slide shows what has happened to the BMI in U.S. adults from 1910 to 2005, along with the lower frame showing the drop in number of hours spent asleep. So as we sleep less, there is an increased incidence of obesity in our nation. There are many potential mechanisms for that. Sleep deprivation is associated with increased hunger, and that's mediated by two hormones, leptin and ghrelin. There is increased opportunity to eat. The more you're awake, the more time you have to eat. There are changes with thermoregulation, where the temperature goes down, you have problems with reduced energy expenditure, and there's increased fatigue. So you tend to do less, you tend to be less active, all leading to reduced energy expenditure. So when we have increased caloric intake and reduced energy expenditure, then unfortunately that leads to obesity. There's actually an interesting relationship between sleep duration and the risk for diabetes. Individuals who sleep less than 5 hours have a twofold increased risk of diabetes mellitus. That goes down as the individual actually sleeps 7 hours. Past 7 hours, there is a slow rise in the incidence of diabetes, and when you get to past 8 hours of sleep, the incidence of diabetes goes 2.5-fold. So this is sort of a bimodal distribution. People who don't sleep or people who sleep too much have a significantly increased risk of diabetes. Sleep duration and the risk of diabetes, this is actually from the Nurses' Health Study. And again, it is confirmed. You get this sort of bimodal distribution where you have less than 5 hours and more than 8 hours an increased risk of diabetes. The sweet spot being between 7 to 8 hours per night. Hypertension can also be affected by sleep duration. Different from diabetes and obesity, you can see that sleeping more than 9 hours per night is not associated with hypertension, but sleeping less than 5 hours is associated with a 60% increased risk of hypertension. And interestingly, this is most prominent in women and less so in men. You can see in this slide, moving forward to total mortality, both men and in women, there is actually increased mortality in women as you sleep less, and also increased mortality as you sleep more than the typical 7 to 8 hours per night in women. The same is true for men, and that is the sweet spot for men and for women appears to be 7 to 8 hours, with the mortality going up as you sleep more and the mortality going up, total mortality as you sleep less. This slide shows this issue with coronary heart disease and sleep. It appears that coronary heart disease by hours of sleep is most prominent in women and less so in men. This may be mediated by the fact that hypertension is more common in women who are sleep deprived than in men that are sleep deprived. This is sleep deprivation. We're not talking about sleep disruption. The Nurses' Health Study again showed that there was this little bit of a bimodal distribution. There was more increased cardiovascular disease when there was less than 5 hours of sleep and more than 9 hours of sleep. So in summary, summarizing rest while asleep, either a decrease in sleep duration from regular of 6 to 7 or 8 hours per night, or an increase from a regular 7 to 8 hours per night predicts all-cause mortality. So moving from 7 to 8 hours to more than 7 to 8 hours, or moving from 7 to 8 hours to less than 6 or 7 hours predicts all-cause mortality. A decrease in sleep duration affects all-cause mortality via increases in cardiovascular health. And an increase in sleep duration affects overall mortality via an increase in non-cardiovascular deaths. So here things are confounded. That is, individuals who may be predisposed for cancer, who may be suffering cancer, or may be having other chronic medical problems that may require them to sleep more. Those individuals may have increased risk of dying from other non-cardiac causes that are possibly more related to the underlying cause that makes them sleep more than the sleep itself. Now, there's a question that comes up, and the question says that vegans required only 3 to 4 hours of sleep and are very active throughout the day. And actually, I haven't seen any data in which vegans required only 3 to 4 hours of sleep. And in fact, individuals who are only sleeping 3 to 4 hours, vegans or non-vegans, they actually probably have a significantly increased risk of hypertension, and as we discussed over here, of cardiovascular disease and diabetes. So there is actually, even though the vegan lifestyle is associated with decreased inflammation, it is, in my understanding, not really a cause for diminished sleep or insomnia. But I would love to sort of see whatever papers can be provided by the questioner as to why he thinks that, or she thinks that that's the case. So moving forward, let's talk a little bit about resting while awake. And then we move on to one of the therapeutic modalities of the South Asian Heart Center, which is a recommendation to do Transcendental Meditation as a stress reduction technique. So resting while awake is also known as, in its purest form, as restful alertness. This restful alertness has been described by Science in 1971 by the American Journal of Physiology, and it's described as a hypo-metabolic state of consciousness accompanied by non-focused alertness or pure consciousness. That is, there's decreased metabolism associated with non-focused alertness or pure consciousness. It's achieved through a process or technique, a process of meditation, and it gives you a great opportunity to rest over stress while awake. So it's something that is done routinely twice a day, but it gives you a nice vacation when you're feeling stressed, rushed, or pressured. Now, meditation means a lot to many different people. There are three major forms of meditation, and meditation in its purest form means thinking. So it is actually a process by which you use your mind or your brain to achieve a purpose. That's what we call in this setting meditation. So the typical meditation technologies or techniques are divided into three. The concentrative or concentration techniques, where you focus on an object, you focus your attention. Examples of those are spiritual exercises where you focus on an image, prayer, rhythmic breathing, and repetitive chanting. There's also a different type of meditation known as contemplative meditation. What you're doing is you're observing an object. You have this open monitoring process, and technologies that use this type of process are also known as mindfulness, Zen meditation, breath meditation, movement meditation, vipassana meditation. And then there are another technology that is known as auto-transcending or transcendental meditation. And the purpose in this auto-transcending meditation is to actually lose the object, is to be in a state where the subject is without an object. The subject is just, is. This is also known, this auto self-transcending is also known as pure consciousness, restful alertness, or just pure being. The process of auto-transcending in transcendental meditation uses a meaningless sound or mantra, which can be easily lost, so that then the subject is just by itself. This is actually a slide showing the EEG of the different main types of meditative techniques. We have focused attention, where you mainly have gamma, open monitoring, where theta seems to be the predominant EEG pattern, and then automatic self-transcending, where alpha waves tend to be the most predominant, and they tend to be well synchronized, and I'll show you some slides. As you move from focused attention to auto-transcending, there tends to be less cognitive control. There's a lot of cognitive control where you focus. Here you focus less, and here there is absolutely no focus on the object. It's just minimal, slight amount of focus on the object, so as the object disappears, there is just pure awareness or restful alertness. So this is actually a paper published in 1971, which was the first scientific description of this state of wakeful hypo-metabolic physiologic state, now known as a state of restful alertness. And this study was done in 36 subjects, and each served as its own control. And they studied the effect of transcendental meditation. And they showed that there was decreased oxygen consumption, and as you see here in the black line, there was a significant drop in oxygen consumption associated with an equivalent drop in carbon dioxide elimination. The respiratory quotient remained the same. This actually showed that the subjects were not willingly holding their breath, but in fact their metabolic rate had gone down, and with this drop in metabolic rate, they actually were using less oxygen and producing less carbon monoxide. This compares to sleep. Here in the blue line, you see that within 20 minutes of the practice of transcendental meditation, there is a 16% drop in oxygen consumption as measured by oxygen, of metabolic rate as measured by oxygen consumption. In the black, you can see what happens to oxygen consumption during sleep, dropping down to about 10% after 5.5 hours of sleep. And this is the effect of oxygen consumption of hypnosis. There actually is no significant effect of hypnosis on oxygen consumption. You can see that during the practice of transcendental meditation, there is actually a more pronounced drop in the metabolic rate than there is during sleep. But this slide is a good opportunity to note that sleep is very, very important, and there is no substitution for sleep and those essential 5 stages of sleep. Transcendental meditation is not a replacement for adequate sleep, but it brings about a state that is uniquely different from sleep, because it's a state in which you have pronounced drop in metabolic rate, a pronounced drop in oxygen consumption, but different from sleep, there is a state of alertness. While sleep, there is no consciousness or altered consciousness. In the practice of auto-transcending, there is an expansion of consciousness and or alertness. And this is actually how it works. There is a technology in which the individual, the subject, is instructed to use a sound, a meaningless sound. The purpose of the technology is for the sound to disappear. So the sound is experienced at finer and finer values. Those finer and finer values of mental functioning tend to be more pleasurable to the mind. So if instructed properly, the individual will use the sound to experience these more refined states of functioning that are more pleasurable to the mind. And finally, the sound will disappear and consciousness will be left by itself. So it's not like you're going on a trance. It's not like you have done anything different, but you just have eliminated the object and the subject remains. That's why in the literature that is also known as pure consciousness or pure being or pure existence. The individual is just purely existing, purely awake, but is not conscious of any object. It's just purely conscious. On the other panel, you see respiratory activity up and down, and the subjects are then instructed to meditate. And once they go through this state of pure consciousness, they actually hit a little button. And you can see that during the practice of meditation, there is this period of cessation of respiration, as then followed by a marker in which the subject has stated that he has come out of this state of pure consciousness, followed then by some slow breathing. There is no compensatory hyperventilation, and then subsequent repeated periods of this sort of pure consciousness state or restful alertness state. Now, the interesting thing about transcendental meditation is that it can actually help people who have insomnia. In this panel to the left, you can see that the mean amount of time taken for individuals with insomnia to fall asleep was about 75 minutes. Following 30 days of the practice of transcendental meditation, there was statistically significant drop from 75 minutes to about 12 to 15 minutes that it took the subjects to fall asleep. This is still abnormal, but it's significantly better than 75 minutes of tossing in bed. And this is just after 30 days of practicing meditation. In the other slide, you can sort of see the effects of compensatory sleep or compensatory REM following 40 hours of sleep deprivation. And in the full columns, you can see how much compensatory dreaming activity is seen versus the subjects that were practicing transcendental meditation in the broken columns. So this is before sleep deprivation. There was not much difference. Following 40 hours of sleep deprivation, there's a significant lower need for compensatory dreaming in those who were practicing the meditation technique, TM, twice a day. Now, what is happening to the brain during the practice of restful alertness? You have the frontal cortex, you have the occipital cortex. You see here we have the thalamus, all the activity in the brain, all the activity that comes into the cortex comes in through the thalamus. In the red, you see that there's a lot of metabolic activity during the practice of meditation. You can see that there are brighter, more reddish color in the frontal cortex, as well as in the parietal region as you compare this area with that area. The thalamus actually shows from eyes closed rest to the TM technique significantly less activity. So in the practice of restful alertness, it appears that the stimuli coming up into the cortex through the thalamus is diminished, but at the same time there is increased activity in the frontal and parietal cortex. Now let's look at the EEG of restful alertness. And this is a simple observation done in San Francisco It was done actually in a public school where the students are routinely taught meditation. They call this quiet time. And they place electrodes in a subject as part of class in the occipital lobe and in the frontal lobe, and they record the EEG that way. This is the EEG with eyes open, where you see a lot of gamma activity. This is in the prefrontal cortex here on the top and in the lower record. In the middle two records, we see the occipital lobe, which is the visual lobe of the brain, again showing gamma activity. When the subject closes their eyes, there is increased synchronization in the occipital or visual cortex of the brain, but there's still persistent gamma activity in the two frontal cortices. With the practice of meditation, transcendental meditation, you can see that there is increased synchronization between the frontal cortex and the occipital cortex. You can think of this as the brain, the frontal cortex being online with the rest of the brain. So the question is, what is the consequence of this? And the consequence is that the executive functioning of the brain occurs in the frontal cortex. As we go through adolescence, we actually start making the appropriate connections between the frontal cortex and the rest of the brain. In childhood and early childhood, those connections are not there. That's why children are not able to make, in many cases, the right judgment, because that area of the brain responsible for judgment is not connected to the rest of the brain. Individuals under stress tend to disengage this sort of frontal cortex. Why? Because when you're running from a tiger in the jungle, you don't need to have a 5-year plan. You just need to sort of get going and run as fast as you can. Subsequently, we have learned that if we maintain our frontal cortex and our ability to think, we can outsmart the tiger, because we did not evolve for running faster than the tiger, but we have evolved to outsmart the tiger because we have a bigger frontal cortex than the tiger, and that frontal cortex is more engaged with the rest of the brain, so that then we can outsmart the tiger. So this is actually now our section on stress and the effect of stress in our brain. We just described the effect of sleep on our physiology and the importance of sleep in normal functioning and in disease. We have talked about a state of restful alertness, which provides a more significant drop in metabolic rate in the physiology associated with an expansion of consciousness and or alertness, associated with improved synchronization between the frontal cortex and the posterior cortex. So what is the effect of stress in the function of the brain and of the physiology? Before we can answer that question, we need to talk a little bit about what do we mean by stress. Stress is defined as physiological when the physiology is unable to maintain a balance or steady state or homeostasis. So it is this inability to maintain a steady state, balance, or homeostasis which leads to physiologic stress. So in this definition, we're not talking about mental pain, we're not talking about confusion, we're not talking about mental suffering. We're just talking about the physiology being unable to maintain a steady state. Psychological stress results from the absence of creativity when the individual or organization is challenged. So psychological stress results because of lack of intelligence, lack of know-how, and lack of creativity to deal with a challenge. Both physiologic and psychological stress have significant negative implications onto our health. So what does stress causes? Well, stress causes a functional lobotomy. The frontal cortex associated with planning, judgment, moral reasoning, working memory, decision making, and the self is lobotomized, is cut off from the rest of the brain. So Hans Selye, who was actually the person who coined the word stress, defines stress as that which obstructs the flow of intelligence. So let's give you an example. This is actually a normal brain. This is the frontal cortex. And this is actually a PET scan looking at sugar or glucose utilization. You can see that there's sort of homogeneous use of sugar in the brain of a normal individual. This is actually the brain of someone highly stressed who uses alcohol and drugs. And these are not anatomic holes. These are functional holes. These are holes where there is diminished metabolic activity. You can see that in the frontal cortex and in the parietal lobes, there is decreased metabolic activity in the stressed individual. And here again, we showed with the practice of meditation, there is enhanced metabolic activity as compared to the eyes closed rest brain in the frontal and parietal cortices associated, as we've noted before, with decreased thalamic activity. So what is the effect of stress on our physiology? Let's just talk a little bit about job strain. And job strain is defined as high psychological demand associated with a low degree of control in the work situation, where you're placed great demand, where you have very little control on how to go about fulfilling that demand. And that is associated with a 2 to 3-fold increased risk for coronary artery disease over a 14-year period. So stress at work can be associated with a 200 to 300% increased risk of coronary heart disease over a 14-year period. This is a very busy slide outlining many of the studies demonstrating a relationship between stress and disease. There is actually neurotic hostility leads to increased cardiovascular disease. Myocardial infarction. About 32.5% of heart attacks are attributable to stress. There's a condition known as adrenergic cardiomyopathy or broken heart syndrome, where the individual that is acutely stressed goes into heart failure. Studies have shown increased incidence of metabolic syndrome and inflammation as a result of work-related stress. And there are other studies demonstrating a relationship between stress-induced obesity, and it appears to be mediated by neuropeptide Y. Emotional triggers can cause heart attacks, and that was seen during the first Gulf War with George Bush Sr. in 1991. The incidence of sudden death while Saddam Hussein was sending rockets into Tel Aviv went up by 58%. When soccer games in Europe are settled with penalty shots, there is a relative risk of death from a heart attack or stroke that goes up by 51% in men. And earthquakes, particularly if they occur on an early morning Monday, can significantly increase the incidence of heart attacks from 149 to 201 the week after the quake, and sudden death from almost 5 per day before the quake to 24 the day of the earthquake. Stress can also affect our immune response. This is a slide that looks at the response to an influenza vaccine. In the hash bar are individuals who serve as control, they're normals. In the black bar, the full bar, are individuals' response who are caregivers of someone with dementia, which is a highly stressful job. You can see that the immune response of individuals who are highly stressed is half than that of the individuals who were not stressed by both ways of measurement. So in summary, this hypo-metabolic state of restful alertness is associated with reduced insomnia, reduced anxiety, and tobacco and alcohol consumption, particularly in PTSD patients. There's a decrease in systolic and diastolic blood pressure. There's a reduction in angina, and there's an increment in exercise capacity in people with coronary artery disease. There's decreased insulin resistance, particularly in pre-diabetics. There's a reduction in total cholesterol and triglycerides. There is an increment in the good HDL cholesterol. There is a decrease in carotid arteriosclerosis. And lastly, individuals who are on maximum medical therapy who are known to have heart disease, there is a 43% reduction in death, heart attack, and stroke versus those who were on maximum medical therapy but were not practicing transcendental meditation. And this was seen within a 5-year period, where there's almost a reduction by half in the incidence of death, stroke, and heart attack in the meditators as compared to those who were on maximum medical therapy alone. There is actually, as shown in this slide, in the red, there is actually, you can see versus the other groups, that there is decreased hospital admissions for almost all diseases or conditions except for childbirth. There is an 87% reduction in the need for hospitalization for heart disease in those who practice transcendental meditation versus those who were not practicing transcendental meditation. This is a 5,000 subject study and it followed Blue Shield hospitalization records between meditators and non-meditators. This is the practice of meditation is associated with younger biologic age. When you look at the biologic age of short-term meditators, that is individuals who have been practicing meditation for less than 5 years versus long-term meditation meditators and control, the long-term meditators who have been practicing meditation for over 5 years tend to be 12 years biologically younger than their chronologic age. And there is a relatively inverse relationship. There's a negative inverse relationship between the amount of time meditating and the person's biologic age. This may be mediated by changes in telomerase, maintaining the health and size of your telomeres and length of your chromosomes. And finally, what happens with survival? And this is actually a study that was done in Oakland. It was done in individuals who had hypertension, and they compared a control group that was involved with health education, another group, a control group that practiced progressive muscular relaxation, and the transcendental meditation group. And you can see that there was a significant difference between the meditation group and the control group and progressive muscular relaxation group for cardiovascular mortality over an 8-year period, as well as all-cause mortality. And in fact, there is a 28% enhancement in longevity in those who practice meditation in this study. There was another study that was actually published before this hypertension study. This was a study done by some scientists at Harvard looking at longevity and health in the elderly. These were elderly who were in a home for the age. And those who practice, the practitioners of TM are the groups are in the blue. The practitioners of relaxation or progressive muscular relaxation are in the pinkish or reddish bar. And those who were practicing mindfulness were in the cream bar versus here the controls in the pink. You can see that the practitioners of TM, these were individuals who started around the age of 73, had a lower blood pressure than the other three groups. They have increased cognitive flexibility, that is, they had increased cognitive creativity, flexibility, less prone to be stressed by changes in their environment, and they, as compared to the other groups, had enhanced longevity, and that was statistically significant. That is, the study was only done for 3 years, and there was actually no mortality in the individuals who were taught Transcendental Meditation and were followed over a 3-year period versus the other groups. So let's just summarize our lifestyle methodology to prevent heart disease and enhance longevity at the Salvation Heart Center. We have talked about nutrition, we have talked about physical activity, and we have also talked about the importance of restful sleep as suggested by the Alameda study. And we have just completed our discussion about the importance and benefit of restful alertness for stress reduction, decreasing cardiovascular risk factors, decreasing hospital expenditures and admissions, and enhancing longevity. So in summary, restful sleep, the sweet spot is between 7 to 8 hours. Less than that and more than that is associated with increased morbidity and mortality, such as hypertension, obesity, diabetes, cardiovascular death, and all-cause mortality. In restful alertness, we know that stress or the inability of the physiology to maintain balance and or homeostasis has grave medical and social consequences, but we also know that the addition of a hypo-metabolic state or restful alertness brought about by Transcendental Meditation, which is different from focused attention meditation and open monitoring meditation, can enhance longevity and reverse many of the abnormalities associated with stress as listed in this slide. So during my talk, I have received some questions. I got a question about why do people die during sleep, and what percentage of people die during their sleep. Actually, I do not have the percentage, so that's something that we would have to look. But a third of the individual's life tends to be spent during sleep. So we should not be surprised that individuals may pass in their sleep. Sleep can lead to significant cardiovascular complications, particularly in the presence of sleep apnea. So sleep apnea can actually increase the risk of dying during sleep. The next question is, what is the percentage of deep sleep and light sleep, and how does the entire sleep cycle account for 100% of the sleep cycle? That's actually a very good question. The light sleep occurs mainly in the first stage and second stage of sleep, and that accounts for about no more than about 5% of the total sleep time. Most of the sleep time is actually accounted for delta sleep, and this is actually the sleep in which we're not dreaming, we're purely unconscious, and we spend about 40% of our time in delta sleep. We spend about 35% of our sleep time in REM sleep, in dreaming, and then the other balance is spent in the first, second, and third stages of sleep. And then the last question was, well, how about pregnancy and transcendental meditation? And that's actually a beautiful question, because during the practice of this restful alertness, we know that the physiology then is brought to a state of restful alertness. It's a state where you have balance. It's a state of steady intellect, as described in the Bhagavad Gita. And this state of steadiness, of being steady intellect, steady physiologic functioning, is of great benefit to the pregnant mother, expectant mother, in which she experiences twice a day this culturing of the physiology of steady state, enhancing her well-being, which then translates into enhancing the well-being of the fetus. And in fact, the most important factor for the good and healthy development of a fetus or a baby in the womb is, in fact, the well-being and health of the mother. Then the question, I just got another question about napping, and what is the value of napping? And napping is present in, and it's of importance in certain cultures. The Spaniards, for example, take their afternoon nap. It's a very nice way for them to escape the heat coming up from the Sahara up into central Spain. But as we discussed at the beginning of our talk, not all sleep is the same. That is, there is a circadian cycle, a 24-hour circadian cycle. And within that 24-hour circadian cycle, we actually have that 8 hours of sleep that are part of the circadian cycle. So the napping sleep is not the same as the circadian 8-hour sleep. And the value of that napping is questionable, even though there have been some publications demonstrating enhanced longevity in individuals who take an afternoon nap. Then the last question is, how many dreams every night? How do I stop this? I feel I'm awake a whole night. Well, I'm not an expert on dream psychophysiology. The fact is that dream individuals are more aware of their dreams or less aware of their dreams. All of us dream. We actually showed a slide about compensatory dreaming. And we found that after 40 hours of sleep deprivation, practitioners of Transcendental Meditation had less compensatory dreaming. So if there's this issue of excessive dreaming, it may be an issue of excessive tiredness, excessive fatigue, and excessive or inappropriate sleep. That is, that individual may be suffering from interrupted sleep, resulting in excessive dreaming, interrupted sleep, such as with sleep apnea or any other condition. So the way to go about that is to investigate causes for disrupted sleep, and also to consider incorporating these technologies of restful alertness to diminish the need for dreaming. So thank you very much for your attention. We hope to be back with you in the near future as we repeat this cycle of lectures. Good night.